My name is Marike, and in this short presentation, I will discuss some of the research that I have been doing as a PhD student in Hospital Group Twente, based in the Netherlands. My research is about the comparison between ultrasound, FDG-PET and MRI for early diagnosis of giant cell arthritis. So giant cell arthritis is a medical emergency. Delayed treatment can lead to severe complications, such as irreversible blindness. And therefore, timely and accurate treatment is necessary in order to prevent these severe complications. However, a temporal artery biopsy, which is used as a current standard for diagnosis of giant cell arthritis, has a low sensitivity. Imaging modalities are increasingly recognized as promising for the diagnosis of giant cell arthritis. And in this study, we compare 3 promising imaging modalities with each other. So patients with suspected giant cell arthritis were recruited, and within a week, ultrasound, FDG-PET and MRI were performed. And we used a clinical diagnosis made by an expert panel after a 6-month follow-up as a reference standard. This diagnosis was blinded for results of imaging modalities. In total, 23 patients with and 19 patients without GCA were included, and all patients were older than 50. Patients' characteristics are described in the first table of the poster, and sensitivity and specificity were calculated for each imaging modality, as can be seen in the figure in the poster. Specificity was 100% for all the imaging modalities, and therefore there were no false positive results. Furthermore, the subtype of giant cell arthritis was investigated. And giant cell arthritis traditionally affects the temporal artery. However, over the years, the involvement of other arteries has been acknowledged. And in the table, we describe the correct diagnosis by the imaging modalities, looking at these different subtypes of giant cell arthritis. Ultrasounds and MRI perform most optimal for diagnosis of cranial giant cell arthritis, while FDG-PET only had a positive result in 20% of these patients. Nevertheless, FDG-PET correctly diagnosed all patients with large vessel involvement. So in conclusion, sensitivity and specificity of the 3 imaging modalities is comparable, and in line with our results, the selection of imaging modality should reflect the availability of the imaging modality on a short notice and the suspected subtype of giant cell arthritis. Thank you very much for your attention.